Good evening, everyone.
Good evening, sir.
I'm audible?
Good
Yes,
evening,
sir.
sir.
Okay.
Good evening, sir.
Very good evening.
Good evening, sir.
Good evening.
Good
Good
evening,
evening,
sir.
Good evening.
Good evening, sir.
Very good evening. So, dear friends, still I will continue the discussion of
क्या दिमाग खराब था क्या?
CMP point. Am I audible? Audible?
Yes, sir.
So, I will continue the discussion of CMP point. Then, after the CMP point, then we'll discuss other point like RP point and many other points. So, quickly, I will show you this list. That as per the Dr. Bull, we have to discuss CMP point, RP point, SMP, PSMP, MP, SCP, AIP, and LDP point. So these are the very special point given by Dr. Bull, and because of these points, we can work on the structure of the organ, function of the organ, and we can work for each and everything of any organ. हम इनके कारण किसी भी organ के structure पर काम कर सकते हैं, function पर काम कर सकते हैं, उसके कचरे की सफाई कर सकते हैं, lymphatic drainage कर सकते हैं. Like quickly if I tell you here, in this list, this point will do cleansing, lymphatic drainage. ये point cleansing करेगा और lymphatic drainage. This point will do the balancing of nerves, because suppose this is the stomach. If the parasympathetic nervous system is active, we feel hungry and we can digest the food properly. But if the sympathetic system is active, like we are in the hurry and worry, we are not relaxed, then we're not able to digest the food. So with the AIP point, we can balance the sympathetic and the parasympathetic nervous system. So we can do autonomic nervous system balancing. तो AIP point के माध्यम से हम हर एक organ की, चाहे वो हार्ट हो, लंग्स हो, स्टमक हो, कि सिंपैथेटिक और पैरासिम्पैथेटिक सप्लाई को ठीक कर सकते हैं. एससीपी पॉइंट, ये एससीपी पॉइंट क्या है? एससीपी पॉइंट इज द कोटिंग. इट इज वर्किंग ऑन द कोटिंग. हमारे हर ऑर्गन के अंदर एक कोटिंग है, बाहर एक कोटिंग है. एवरी ऑर्गन इज हैविंग कोटिंग इनसाइड और द आउटसाइड. Suppose there is a degeneration of the coating of the stomach, then there is a stomach ulcer. अगर हमारे स्टमक की जो अंदर की कोटिंग है उसमें थोड़ा डिजनरेशन हो गया तो स्टमक अल्सर हो जाएगा. एससीपी पॉइंट के माध्यम से हम अंदरूनी और बाहरी सभी प्रकार की कोटिंग पर काम कर सकते हैं. वी कैन वर्क ऑन ऑल द कोटिंग्स, राइट. CMP point is working overall, especially on the structure of the organ, and RP point is working on the function of the organ. RP point on the function. So CMP point is working on the structure and CMP point is working for everything, like all the pathology of the organ. CMP point सभी प्रकार की पैथोलॉजी पर काम करता है किसी भी ऑर्गन की. लेकिन RP point स्पेशली अगर वो ऑर्गन फंक्शन ठीक नहीं कर रहा है तो उस पर वर्क करेगा. सो आरपी पॉइंट स्पेशली वर्किंग फॉर फंक्शनिंग. Now, in the same way, SMP and the PSMP point, we have to discuss. SMP point is called specialist point. SMP point means specialist. What is the meaning of a specialist? Like you are suffering with a heart problem, you will go to cardiologist. If the person is suffering with some problem, some female is suffering with a gynec problem, will go to the gynec doctor. Okay. If the person is suffering with a problem of the bones, we will go to the orthopedic doctor. So we are choosing the specialist. हम हर बीमारी के लिए स्पेशलिस्ट ढूंढते हैं ना, बोलते हैं कि भैया हड्डियों की तकलीफ है तो ऑर्थोपेडिक के पास जाओ. So SMP point means special point. Okay, this heart is having some problem. Okay, go to the heart doctor. So there is a very special SMP point. There is a very special point for the heart. There is a very special point. Someone is telling, I am suffering with a chest pain. Okay. On the report, we found there is a problem with the heart. Okay, go to the SMP point. Go, because we have to show to the specialist. SMP point means specialist. फिर उसके नीचे लिखा है PSMP point. PSMP means जनरल फिजिशियन. कोई भी प्रॉब्लम पर काम करेगा. ओके, आपको चेस्ट पेन है, he will give one medicine for heart, one medicine for lungs, one medicine for all the ribs around the chest. तो PSMP point means छाती का दर्द है ना, कोई भी प्रॉब्लम हो तो PSMP point काम करता है. स्पेशली overall it is like a general physician. जनरल फिजिशियन के पास आप बुखार लेके भी जा सकते हैं, थोड़ा बहुत चोट लग गई तो वो थोड़ा बहुत टाँके लगा के भी ठीक कर देगा. सो जनरल फिजिशियन कैन डू लॉट्स ऑफ वर्क. One doctor for many issues. The PSMP is one doctor for many issues, but the SMP point is a specialist. Now regarding the MP point is, it's a very important point. Every meridian is having many MP points and we are treating them. They are working. So in this way, one by one, we have to discuss all the points. Every meridian is having CMP point, RP point. हर मेरिडियन के ऊपर CMP point होते हैं, RP point होते हैं. Every meridian is having SMP point, PSMP point. Every meridian is having SCP point, AIP point, and LDP point. Every meridian. Now, suppose you want to do the cleansing of the lungs. Okay, the LDP point of the lungs. You want to balance the nervous system of the lungs, AIP point of the lungs. ओके, तो इस तरह से हम हर मेरिडियन का में इतने सारे पॉइंट्स हैं, जो भी जरूरत है वो उठा लेते हैं. कई बार मल्टीपल पॉइंट भी उठा लेते हैं. इज इट क्लियर?
Sir, MP is not clear.
एमपी विल कम, क्योंकि एमपी तो क्या होता है ना कि बहुत सारे पॉइंट्स होते हैं. हर मेरिडियन में देयर आर मेनी एमपी पॉइंट. वो ऐसे होते हैं कि मल्टीपल पॉइंट्स. एक प्रॉब्लम के लिए देयर आर माइट बी मेनी पॉइंट, दे कैन वर्क. ओके, तो उनसे हम काम करा सकते हैं. ओके, जैसे आपके घर का पंखा खराब हो गया तो देयर आर मेनी पर्सन हु कैन रिपेयर इट. यू विल कॉल, ओके ही कैन रिपेयर. Oh, he is not available. Okay, he can repair. He is not available. He is available. Yes, he will come and he can repair. So there are many MP points. Anyone can repair your fan. In the meridian, there are multiple MP points. Okay, so they can do the work. So we will discuss. Now we are discussing CMP point. Now CMP point, as per our discussion, what is the CMP point? हमने CMP point के बारे में बात करी थी. Mainly it is working on a structure. Okay, Then RP point will working on the functions. So right now we are talking about the structure कि मुख्य रूप से यह किसी भी ऑर्गन के स्ट्रक्चर पर काम करता है. जैसे स्ट्रक्चर का मतलब क्या? व्हाट इज द मीनिंग ऑफ स्ट्रक्चर? Degeneration. Oh, in the X-ray we can see degeneration. That is the structure product. Okay, we can see lots of redness, inflammation, swelling, some structure problem is happening. Location तो हम बताएंगे, अभी हमने location कहाँ बताई है. We will discuss the location of each and every point in the detail. Right? We will discuss.
हाँ, CMP पॉइंट की लोकेशन
कल लेक्चर नहीं देखा आपने?
नहीं, कल नहीं देखा था.
तो वीडियो देख लीजिए. अभी मैं रिपीट करूंगा तो सारे
तो
लोगों
सर वो वीडियो में देख रही थी, पर एग्जैक्ट डिस्टल
हाँ, वो
जॉइंट के
हमारा
नीचे होना था.
okay, I got it. Even I got some more messages. Next week we are working only for location. Only for
ठीक.
location. So don't worry.
Okay.
We are understanding the concept and we will work only for location, exact location. So don't worry for it. Okay. Even I got other messages also that they want to make sure the perfect location of the points. Then I told, don't worry, we will work on the next week. So today let's try to understand this, what we are discussing, right? Okay. Because still you are a little away from the treatment. As per Dr. Bull. Dr. Bull treatment we will able to do very properly when we understand CMP, RP, SMP, everything, right? Then we will able to make the very good protocol of the Dr. Bull. Okay. तो चलिए अब हम आगे बात करते हैं. Let's see here. एक बार मैं क्विकली आपको वो दिखा देता हूं. So now we understood CMP means control measurement point, working on structure. Okay. So when the organ is weak, inflamed, degenerated, out of balance, we can work. Any pathology we can use CMP point. Like enlarged heart, problem with the valve. Okay. So actually CMP point we can use for any problem, but especially structure. Okay. CMP point is for restoring the functions of any organ. CMP point का प्रयोग हम किसी भी स्ट्रक्चर के फंक्शंस को रिस्टोर करने के लिए करते हैं. Yesterday we have discussed this. The person is suffering with a cardiac problem. Suppose there is a coronary heart disease, we will use the CMP point of the heart. There is a heart attack, there is a congestive heart disease like tachycardia, bradycardia, हार्ट की रेट का बढ़ जाना, घट जाना, हार्ट फेलर हो जाना. ओके. हार्ट को सप्लाई करने वाली कोरोनरी आर्टरी की प्रॉब्लम हो जाना, द enlargement of the heart or there are many other problem of the heart, cardiomyopathy, rheumatoid heart disease and the high blood pressure. So for all the things what we can use the CMP point of heart. हम हार्ट के CMP point का यूज कर सकते हैं. Then we discussed about the liver. There are any problem of the liver, like fatty liver, maybe.
Sir, 1 minute. Can I ask a question?
Yeah.
आपने बोला CMP for structure. So when it is tachycardia, bradycardia, वो function है ना? Structure.
I told CMP point can be used for everything.
Okay.
And plus, most of it is working very nicely for structure.
Okay, sir. ठीक है, thank you.
So now we are coming to the liver. So fatty liver, hepatitis, liver cirrhosis, liver cancer, cyst in the liver, abscess in the liver, or portal hypertension, we can use CMP point of liver. I am giving you many examples, only my purpose, so that we can understand that CMP point can be used. Because yesterday many person asking, can I use for this, can I use for that? So that's why I'm telling you, for any disease of the liver, we can use CMP point of the liver. हम liver का CMP point use कर सकते हैं. So now lung, we have many diseases of the lung. Okay, थोड़ा सा font छोटा हो गया, but I will tell you asthma, इसे मैं बड़ा कर दूंगा, don't worry. और chronic obstructive pulmonary disease, there are many problems of the lungs like bronchitis, pneumonia, tuberculosis. Definitely we are not treating the tuberculosis patient, but when the patient is coming with a past history of tuberculosis, still they are having some problem. जैसे अभी मेरे पास एक पेशेंट आया था जिसे ट्यूबरक्लोसिस हुई थी पहले और उसे फॉरेन कंट्री में जाना था. He wanted to go in the foreign country, but he was having previous history of the tuberculosis. Now there were no any tuberculosis. अभी कोई tuberculosis नहीं थी, उसे previous history of the tuberculosis थी. He wanted to go in the foreign, but पहले मेडिकल रिपोर्ट कराते हैं ना, कई कंट्रीज में आप जाओगे तो पहले पूरा बॉडी का मेडिकल रिपोर्ट कराते हैं. In the medical report, in the some X-ray or MRI, he was having a scar in the lungs. लंग में एक निशान बना हुआ था, scar in the lungs. He was not having any problem currently, so he came to me and, can you treat my scar? Yes, and we know we have treatment of the scar in the Dr. Bowl. We have special treatment for the scar. Then I treated him, and after doing the treatment, he became normal. Okay, then he went to the foreign country, shifted to the foreign country. Even I told that time, मैंने उसको बोला, I don't know my treatment will work or not, but I will try my best. I have given 20 to 25 treatment only in the span of 3 months. मैंने 3 महीने में से 20 से 25 ट्रीटमेंट दिए, उसके बाद वो एकदम ठीक हो गया. Okay, so in this way, when the person is coming to you with the problem of the lungs, the past history of the tuberculosis now, but having a scar, we believe, हम ऐसा मानते हैं कि scar भी problem create करता है. Even the scar will create the problem. Like scar, कहीं चोट लगी थी तो निशान रह गया, या फिर सीजरियन डिलीवरी हुई तो निशान रह गया. Scar because of anything. If it is there, it will definitely affect the energy. So whenever we treat any patient, we ask the patient, have you undergone with any surgery? Have you any history of some past history of injury? He will tell yes. We never forget to treat the scar. अगर हमने उसके scar को ठीक नहीं किया, हमारा ट्रीटमेंट अधूरा है. Our treatment is incomplete. आप बोलोगे घुटने का दर्द है, पेशेंट घुटने के दर्द के लिए आया है, स्कार तो पेट में बना है क्योंकि उसने कुछ सर्जरी करवाई थी, तो वो उस स्कार को थोड़ा सा ट्रीट करना पड़ेगा. यू हैव टू ट्रीट दैट स्कार बिकॉज एंटायर बॉडी इज कनेक्टेड एंड सम टाइम नी पेन माइट बी बिकॉज ऑफ दैट स्कार. ओके, सो इफ द पर्सन इज हैविंग द प्रॉब्लम ऑफ द लंग्स, वी विल ट्रीट द.
One question.
Yeah.
You treat it only by using CMP?
No. I made the protocol. अभी आपको कितने दिन हुए हैं अभी आपको?
अभी 3
3 दिन
दिन
हुए ना.
हाँ.
मैं आपको CMP, RP और सबका प्रोटोकॉल बता दूंगा.
और
ये क्या है समझ में नहीं आ रहा है.
ओके
आई विल गो स्टेप बाय स्टेप.
ओके
एक जो मैंने पॉइंट लिया था वो CMP था.
ओके ओके
Entire protocol is not that.
Okay.
Will come, right?
ओके
Okay.
थैंक यू.
पर अगर ये स्कार एक्यूप्रेशर की मॉक्सिबशन, जिंजर मॉक्सिबशन में हुआ है तो उसको भी ट्रीट करना है?
Yes. अगर देखो स्कार हुआ है बिकॉज ऑफ द जिंजर मॉक्सिबेशन, लेकिन स्कार हम कब बोलते हैं? अभी इमीडिएटली नहीं हम, इट विल नॉट इफेक्ट. इट विल सपोज आफ्टर 1 year, maybe after 6 months. It's still there. Then you have.
Okay, because I got ginger moxibustion done by Dr. Lohia for knee pain in the medial side. So knee pain was not there, but now I'm getting knee pain in that leg itself, lateral side and all. So is it due to the scar or?
Yeah, so it
There is a scar still there.
yeah. So it might or it might not be due to the scar, but you have to treat the scar.
Okay.
When you treat the scar, definitely it will work some way, little bit or no more. But you have to treat the scar for sure.
Okay.
Scar को छोड़ नहीं
Can
सकते.
we let Sir continue with his line of thought, and rather than asking questions now, can we keep it to the end? Let him finish the topic one by one, systematically structured. Otherwise, he will lose his train of thought.
Yeah, thank you.
Can we let him go rather than
I
asking
agree.
question here and there everywhere?
So okay, you
I
can
agree.
see if there is a very important questions which is very urgent to ask, because without that, if you are not able to go forward, then you can ask. Otherwise, you can keep the question for last. It will be very good so that we can finish major portion. Okay. So now we are coming to the lung. We are discussing the lungs. So we can see the problem of the asthma, problem of the COPD, problem of pneumonia, tuberculosis, lung cancer, some problem of the lung. Okay. We will do the CMP point of the lungs. We will add the CMP point of the lungs. Like we can see there are many problems. This is the list of the lung problem. Now the disease of the blood, we already have discussed. If we want to work on the blood chemistry, we have to work on the spleen. अगर हमें blood chemistry पर work करना है, हमें spleen को treat करना होगा. So the right side meridian is the pancreas meridian, and the left side meridian is the spleen meridian as per the Dr. Bowl. So we will working on the left side spleen meridian to treat the blood disorders. So there are many problems like the problem of the spleen, the enlargement of the spleen or spleen rupture, or the problem of the platelets, the problem of the WBC, RBC. We will work on the spleen, and any other problem of the spleen, we will work on the spleen meridian. So now, yesterday also we discussed if the person is suffering with any problem of the endocrine organ like ovary, thyroid, adrenal gland, and there are many other endocrine gland also. So any endocrine glands, we will work on the triple Warmer meridian, because the triple Warmer meridian is the endocrine meridian. हमारा triple Warmer meridian ही endocrine meridian होता है. Okay. So in this way, there are many diseases of the endocrine origin, like tumor of the pituitary gland. We will work on the triple Warmer meridian and will use the CMP point of the triple Warmer meridian. So there are many hormonal problems: gigantism, acromegaly, diabetes, and excessive milk secretion from the breast without pregnancy, thyroid disease, and there are multiple variation of the thyroid like goiter, parathyroid problem, adrenal problem, type 1, type 2 diabetes, and other issues because of the pancreas, the problem of the ovary. These all problems, we will work on the triple Warmer CMP point. So when I will discuss the diabetes protocol and I will take the CMP point of the diabetes, then you have to understand quickly why I am taking the CMP point of the diabetes. Why I am taking CMP point of the diabetes? Because diabetes connected to the pancreas and which is endocrine gland. अगर मैं triple Warmer का CMP point लूंगा, can I take in the thyroid or not? CMP point of the pancreas, CMP point of the triple Warmer. क्या मैं thyroid की बीमारी में triple Warmer का CMP point ले सकता हूँ क्या नहीं?
Yes, sir.
Yes, sir, ले सकते हैं.
Can I take, if the female is having unwanted hair growth here, can I take the triple Warmer CMP point?
Yes.
If the female is suffering with the polycystic ovarian disease, can I take triple Warmer CMP point?
Yes, sir. Yes,
Then
sir.
if the male is having some erectile dysfunctions or the problem of the testosterone hormone, can I take triple Warmer CMP point?
Yes, sir. Yes, sir.
So we have to open our mind and we have to understand, okay, this person is having hormonal issues. So let me take triple Warmer CMP point, because triple Warmer meridian is endocrine meridian. ट्रिपल वार्मर मेरिडियन ही हमारा एंडोक्राइन मेरिडियन है. गॉट इट? So in this way, now I will tell you, we have to, I will tell you, there are many patients suffering with asthma, breathlessness because of stress. Have you heard stress-induced asthma? सुना है आपने? During the stressful condition, many person asking, pump. Have you seen many person when they are very stressful, they are asking, searching inhaler. Then they are taking inhaler, then they are relaxed. So because stress is a big factor. Stress is a big factor who is aggravating asthma. Do you know why? Why? Because which endocrine gland is connected with the stress? Adrenal gland. I will tell you, if you put ACT, if you control the ACTH hormone, adrenocorticotropic hormone, if you control the adrenal gland, you can work on the asthma. So that's why, can I take triple warmer point in the asthma patient? Yes. Why? Because if the asthma is stress induced, I have to control the adrenal gland. So for the endocrine glands, we have to open our mind. Okay, pituitary gland, thyroid gland, pancreas, ovary, testes, adrenal gland. We have to know little bit functions of these all endocrine glands so that we can work on the various problems. हमें इन सारी एंडोक्राइन ग्लैंड्स के बारे में थोड़ा पता होना चाहिए ताकि हम ट्रिपल वार्मर का पॉइंट वहां लगा सकें. द CMP पॉइंट ऑफ द ट्रिपल वार्मर वहां डाल सकें. जस्ट वी वांट टू कंफर्म, ओके, हार्मोनल प्रॉब्लम, ट्रिपल वार्मर, ओवर. देन विल प्रोसीड अहेड. फिर हम आगे बढ़ जाते हैं. सो नाउ वी कैन सी हियर there are many patients who are not having good sleep. You know why? Because of pineal gland. In the brain, there is a pineal gland secreting one hormone that is called sleep hormone or melatonin. हमारी pineal gland जो brain के अंदर होती है एक हार्मोन बनाती है जिसे हम melatonin कहते हैं. तो हम गहरी नींद में सोते हैं. We sleep very nicely. But if the pineal gland get disturbed, then many person might get the problem of insomnia, अनिद्रा. अनिद्रा की बीमारी हो जाती है. क्यों हो जाती है? अगर हमारी pineal gland ठीक से काम नहीं करती. How to work on the pineal gland? We can work with the CMP point of triple warmer meridian as well as with the yoga nidra, deeper level of the sleep, and going early on the bed. आप बिस्तर पर जल्दी चले जाओ तो नींद आने लगती है. वैसे हर किसी की जो स्लीप साइकिल अलग होती है, but I will tell you, even the person is having different sleep cycle. But if you are going on the bed and you are sleeping immediately, it means your pineal gland working fine. But if you are going on the bed and you are not able to sleep very easily, you are struggling to sleep, it means you have to work on the pineal gland. How to work on the pineal gland? By CMP point of triple warmer. Because triple warmer is a very important meridian. Okay, that's why if you see the image of triple warmer meridian, it looks very beautiful. I will show you. I will show you the internal image of the triple warmer. Let's see here. So this is the external pathway of the triple warmer meridian. ये तो triple warmer meridian का बाहरी pathway है. But if we see the internal pathway, this is the triple warmer meridian. We can see how we can see the three stars. Upper star, middle star, lower star means upper warmer, middle warmer, lower warmer. Upper warmer is working till the head. Middle warmer working in the area below the diaphragm. Lower warmer working in the genital part and in the lower part. So when our triple boro meridian is good, our all endocrine glands working very nicely. Okay. So is it clear to everyone? So now, whenever person is having any problems, any hormonal problems, you have to find out, you have to make the list. Pineal gland, sleep, pituitary gland, many hormones. So you have to make the list, and accordingly you can choose triple Barmer CMP point. Okay, fine. So now, there are lots of people suffering with the problem of the nerves. Nowadays, the problem of the nerve are very, very common. We can see here. If the person is suffering with any type of the nerve problem, the common problem we know, sciatica nerve, okay, sciatica, neuralgia, trigeminal nerve. So ultimately, we are thinking for nerve. If the person is having any problem of the nerve, we will use the CMP point of the nerve degeneration meridian. So we can see here, there are lots of problems. Suppose some person is having diabetes, and after maybe 15 years, 20 years, now person is telling, I am feeling some problem in my feet. I cannot feel any sensation in my feet. 15-20 साल के बाद या पहले और बाद एक व्यक्ति के पैरों में न्यूरोपैथी हो गई और उसे गादी जैसा लगता है, पैरों में कुछ पता नहीं चलता, कांटा चुभ जाए पता नहीं चलता. Even the person is not able to feel anything. This is neuropathy, the problem of nerve. We will go in the nerve degeneration meridian. The multiple sclerosis is the problem of nerve. The Parkinson disease is the problem of dopamine and the nerve. Alzheimer's disease, trigeminal neuralgia, sciatica, or any other type of the nerve compression, paralysis, some migraine headache, and facial paralysis, and Bell's palsy. So when we talk about the nerve, जब हम nerve की बात करेंगे तो लोगों को लगता है कि nerve मतलब sciatica nerve, बस sciatica nerve ध्यान आती है सबको या trigeminal nerve याद आती है. लेकिन nerve play very, nerve means the entire body is having the network of nerves. हमारा संपूर्ण शरीर में नर्व का जाल है.
सर पार्किंसन में नर्व्स होती हैं कि डोपामाइन निकलता उसका? इट्स
one nerve, another nerve. So from the one nerve, dopamine coming to the next nerve. So because of improper dopamine, one nerve cannot stimulate the other nerve. Ultimately, dopamine is there, but who is suffering? Nerve is suffering. Nerve is passing the message jumping from one nerve to other nerve to other nerve. Now between two nerve, dopamine is a chemical messenger who pass message from one nerve to another nerve. So ultimately, who is suffering? Nerve is suffering. So we will work on the nerve also in the Parkinson. Got it? Yeah. Are you clear? The why paralysis is clear, is connected with the nerve. Everyone is clear. The paralysis having connection with the nerve. Facial paralysis having connection with the nerves. Okay, everyone is clear for that. Okay. Oh, my nerve compressed in the lower back. There is a nerve compression here. So pain in the arm, tingling sensation in the fingers. Okay. Or pain in the thumb. Why? Because the nerve compressed in the neck. Brachial neuralgia. सुना है किसी ने brachial neuralgia? यहाँ पर हमारे brachial plexus आता है गर्दन से और दब जाए तो हाथों में झंझनाटी आती है. गर्दन में प्रॉब्लम होती है, हाथों में झंझनाटी आती है. The person is having compression in the neck and problem in the fingers, problem in the arm. Golfer elbow, tennis elbow, these are the nerves coming from there. Carpal tunnel syndrome, we will use nerve degeneration meridian. Okay. For these all problems, we are going to use nerve degeneration meridian. because the different nerves, various types of the nerves are supplying the different part. अलग-अलग parts.
Plantar fascia also.
That is fascia. That is different. Fascia. Fascia is different. Nerve is different, right? We will discuss fascia also. Fine. So now, so we have understood there are too many nerves. I have written only few nerves here. मैंने कुछ ही nerve लिखी हैं. There are many nerves. If you see the body, अगर आप संपूर्ण शरीर को देखो, let's see here. The body is having network of nerves. Let's see this. These are the nerves. How the nerves are going. The person might suffer with the problem of the thumb, index finger, middle finger, ring or the small finger, or elbow pain, shoulder pain, pain anywhere in the body because of the nerves. We can see the network of nerve. These all are nerve from top to bottom. Nerve play a very important role. I will give you an example. There is one nerve that is called pudendal nerve. Pudendal. Going to the genital part. And because of this, person is suffering with the sexual problem. So, as soon as we work on the pudendal nerve, the person is getting improvement in the erectile dysfunction or some sexual problem. Are you getting my point? How the nerve are very important. Nerve means, just like I am discussing with you something. Okay, but I need light. I need fan. I need AC. I need to maintain the temperature of the room. I need light. So these are electricity. Electricity, without the electricity, it's very difficult to do anything. So nerve means they are bringing the electricity. Nerve कहाँ क्या करती है? Nerve brain से वो electricity लेके आती है. So there are many nerve. I have seen, actually, this is the discussion which will come later, but quickly I will tell you, one female is suffering with the urinary tract infections. Again and again, frequent UTI. Okay. Then I treated one nerve, that is ilioinguinal nerve, here in the inguinal part. The nerve is coming that in the inguinal part, ilioinguinal nerve. In the 1 or 2 sittings, she got complete relief with the UTI, urinary tract infections. She was trying since 6 months and was meeting with a different doctor. Nerve play a very, very important role. We have to find out, okay, you are having this problem, add one point of the nerve. Okay. So it will become very easy. Got it? Clear? You understood the importance of nerve? Okay. So whenever
सर नाम क्या बताया नर्व का? इलियो, I'm not clear.
there are two nerve who is connected with these UTI. I have seen many females suffering with the UTI because of ilioinguinal nerve and iliohypogastric nerve. There are two nerves.
But you have to take nerve CPM point.
Yeah, we have to take so we have to take the CMP point of the nerve degeneration meridian. Then you will ask, he is suffering with the UTI, why you are taking CMP point of the nerve degeneration meridian? That's why I have to make clear. मुझे आपको बताना तो पड़ेगा कि भैया मैं CMP point of the nerve degeneration meridian क्यों ले रहा हूँ? मुझे और भी पॉइंट लेने पड़ेंगे. I have to take the RP point also. क्योंकि RP point वहाँ के functions को improve करेगा. I have to add some more point also. But you can ask, the female is suffering with a urinary tract infection. What is the connection of nerve? Okay, iliohypogastric nerve, ilioinguinal nerve are connected. And sometimes just we work on that nerve, we see quick effect. Okay? So in this
Sir, I have a question.
yeah.
Will all meridians have only one CMP, sir?
No. Some is having more than one.
Okay. In that case, both have to be taken, sir?
Yeah.
Okay. both CMPs have to be taken.
We can take both. We can take one. It depends on us. Even you take the one, it's okay. We can take more than one also. Okay, we will
Okay.
understand. That is not difficult task. We will.
Okay, sir.
Okay. Fine. So now let's talk about the small intestine. Small intestine is very important part of the human body. We never focus on a small intestine. Okay, like suppose someone is suffering with a vitamin B12 deficiency. Nowadays it's common or not? Vitamin B12 deficiency is common or not?
Yes.
Very common.
Most of the
common.
patient is suffering with a vitamin
Very, very
B12
common, sir.
deficiency nowadays. Very common. Yes, are agree?
Very common.
Yes.
Okay. So the absorption of the vitamin B12 is happening in the small intestine. So we have to work on the CMP point of the small intestine or not? Tell me. Tell me.
Yes.
अगर किसी को विटामिन B12 की कमी है और विटामिन B12 हमारी छोटी आंत में और बड़ी आंत के थोड़े से भाग में एब्जॉर्ब किया जाता है. So vitamin B12 is made by our friend bacteria in the intestine. कहते हैं ना कि वो दही वो खाओ जो कर्ड राइस से विटामिन B12 मिलता है. फर्मेंटेड फूड, पिकल्स है ना. प्रीबायोटिक्स क्या होती है? प्रीबायोटिक मीन्स
प्रोबायोटिक.
So when we are eating this, they are going in the intestine. They are improving वो हमारी बैक्टीरिया जो बैठते हैं ना, the bacteria are located in the intestine. So we are giving them more bacteria. They are our friend bacteria. If the person is suffering with a vitamin B12 deficiency, we have to work on the CMP point of the small intestine. Okay. And you have to also understand this concept. Okay, I have to work on the small intestine because this person is having vitamin B12 deficiency. And one more concept. Spleen is the king or queen, whatever you want, can tell. Spleen is the king or queen of entire intestine. जैसे क्या होगा? Small intestine is there, large intestine is there, stomach is there, everyone is there. But spleen is the queen or king. Okay. Why I'm telling spleen is the king or queen? We might think to stimulate spleen also. If the person is suffering with any problem, the small intestine, large intestine, stomach. Okay. Coming back to the vitamin B12, I will show you one list. If the person is suffering with the problem of the small intestine, we have to treat we have to take the CMP point of the small intestine. So let's see here. Some person is suffering with the abdominal. Okay. So this is not the small intestine, this is the large intestine. Sorry. So one person is suffering with many problems like cannot digest the milk, lactose intolerance, ulcer in the duodenum. Duodenum is the part of the small intestine. There are many diseases of the small intestine, but I am bringing your focus on the many very common diseases like iron deficiency anemia, vitamin B12 deficiency, many disease like celiac and the Crohn's disease. जब आप क्लिनिक चलाओगे ना, ये सारे पेशेंट आएंगे आपके पास. Crohn's disease, celiac disease, all patient will be coming to you with the reports. In the report, it's written Crohn's disease. Then you have to understand, okay, you have to focus on small intestine. Put the CMP point of the small intestine. Got it?
सर किसी का अगर विटामिन B12 बढ़ जाए तो उसके लिए भी एक क्या ट्रीटमेंट देंगे?
CMP point is whatever we are adding the point, they are doing balancing. They are doing balancing. Okay. Sometimes I have seen the person is having excessive vitamin B12. Maybe because he has taken injection of vitamin B12. And one patient is there, he's coming. He's Jain. We know Jain and pure Jain. Even he is not passing from the lane where non-veg is there, right? जहाँ non-veg बिकता है उस गली से भी नहीं निकलते, है ना? Even he is not eating garlic, onion, not eating any type of the non-veg, but vitamin B12 is 2000. 2000. Very high. Okay. For that patient also, we have to treat this point only, because our this point is bringing the balance. Most of the people is having deficiency of the vitamin B12. Some of the patient you will see, okay, this is having a very excessive vitamin B12. We ask only one question: have you taken injections of the vitamin B12? Patient is telling, yes, I have taken injection. Okay, then it's okay. It's high right now, but after few weeks, it will be normal. जब कोई व्यक्ति विटामिन B12 की इंजेक्शन लेता है तो टेम्परेली उसका विटामिन B12 एलिवेट हो जाता है, बढ़ जाता है।
कॉन्सिक्वेंसेस क्या होते हैं हाई के?
क्या
जब हाई होता है तो व्हाट हैपेंस?
Sickle cell.
Yeah, so I will tell you, like initially there is we can't see any effect. We will not see any, because after taking the vitamin B12 injections, if the vitamin B12 is excessive, what will happen? You are asking this, right?
Yes.
तो क्या होगा कि अगर vitamin B12 ज्यादा है, some person has taken the injections and because of that the vitamin B12 is very high, so it will not see any changes, because after that body is in the very much need, तो वो कुछ समय में उसे settle कर ले. You know why we need vitamin B12? Why we need vitamin B12? We need vitamin.
For oxygen, sir. For respiration.
I mean, there are many functions of the vitamin B12. One very important functions. If the person is suffering with the vitamin B12 deficiency, he will come with the problem of nerves. Nerve. Suppose you are treating the nerve problem, because vitamin B12 is very much necessary for healing the nerve. Nerve also needs some nutrition. Nerve without the vitamin B12, nerve will ऐसे नर्व घिस जाएगी, जैसे एक तार होता है ना, तार को ऐसे घिस दो, ऐसे you are just scraping the wire. Okay, scraping
muscle
the wire.
cramps, muscle cramps due to deficiency of B12.
What?
Muscle cramps.
Yeah, muscle cramp also there. So the person is suffering with the vitamin B12 deficiency. There might be many symptoms, but very important symptom: scraping of the nerve, degeneration of the nerve. So person will be suffering with tingling, numbness, nerve pain. The person will be coming with the problem of nerve. Then immediately you have to see whether the vitamin B12 is deficient. If the vitamin B12 is deficient, then give the vitamin B12 immediately. Otherwise, person will suffer with some nerve problem. Okay. So vitamin B12 is very much necessary for nerve, brain health, because nervous system brain is nervous system. Okay. There are a big list of the vitamin B12. So I am coming to my point. You want to improve your brain? Treat a small intestine. Why? Because a small intestine CMP point will improve the absorption, of the iron, vitamin B12. Then if the vitamin B12 is good, then your nerves will be working very nicely and the brain health will be good. Some person is suffering with the tingling in the hands. एक व्यक्ति बोलेगा कि मुझे टिंगलिंग होती है, हाथों में खाली चढ़ती है, नमनेस आती है. आप ट्रीटमेंट दिए जा रहे हो, कोई फर्क ही नहीं पड़ रहा है क्योंकि विटामिन B12 डेफिशिएंट है. So when you are treating any patient is having neurogenic problem, nerve problem, always think for vitamin B12. Okay. As soon as you give the vitamin B12, you can improve the health. So see this list.
टिंगलिंग को सर पार्किंसन से कंपेयर कर सकते हैं, सेम सिमिलर थिंग.
क्या बोल रहे हैं जी?
पार्किंसन एंड tingling all the fingers is similar problem.
No, Parkinson is having different. Parkinson is definitely it might be because of small intestine also, But Parkinson might be because of some other issues also, because Parkinson is the disease which is happening because of the long illness. Maybe it is the illness of a small intestine, maybe it is due to some other problem. But small intestine also play a very important role, because if the vitamin B12 is not enough, then it will disturb the brain and the nerve health. And if the nerve health is not good, then person might be suffering with many problems of the brain, including maybe Parkinson, because there will not be good dopamine, there will not be good serotonin in the brain, just because of a small intestine. इसीलिए कहते हैं कि our gut, you know that this is the very important thing I would like to tell you here. If we talk about the gut is second brain.
Brain, yeah.
Have you heard this? If you want to work on the brain, then work on the gut. Work on the gut. Okay, आप अपनी gut पे काम करो. In the brain we are having neuron. In the gut also we are having neuron. In the brain we are having 100 billion neuron. In the gut also we are having 500 million neuron. Million is a small. So this is a lesser. Billion is very high number. Million is little lesser than the billion. So if you are eating the right food, इसीलिए कहते हैं कि जब आप खाना खाते हो तो बहुत ही ये सोच के खाओ कि आप अपने ब्रेन को फीड करने वाले हो. If you are eating unwanted, like unhygienic, bad food, means bad. I am telling bad food means bad in the nutrition. Then it will damage the brain. And if we want to work on the brain, just work on your gut or the small intestine. Improve the proper absorption of vitamin B12. It will improve the serotonin, dopamine. You will be very happy. If you keep your small intestine happy, you will be very happy. Right? Are you getting my point? अगर आप अपनी स्मॉल इंटेस्टाइन को अच्छा रखो, आपके चेहरे पर खुशी रहेगी. खुशी आती है डोपामिन से, सीरोटोनिन से. The person is suffering with the depression because of problem of the dopamine or the serotonin. जो लोगों को डिप्रेशन होता है ना, तो सीरोटोनिन डोपामिन के कारण होता है. आप स्मॉल इंटेस्टाइन का CMP पॉइंट लगाइए, then we can see the improvement. Okay, fine.
For IBS also, small intestine has to be taken.
Definitely irritable bowel syndrome, we have to take small intestine also.
सर माउथ अल्सर भी
The celiac disease, and the person is not able to digest the gluten. Many person are
Sir,
not.
gut में क्या क्या include होता है? Mouth to anus?
Yeah, mouth to anus, entire part. That is the gut. Yes. So many person are not able to digest.
सर अगर माउथ अल्सर हो जाए तो भी
If the person is
स्मॉल
suffering,
इंटेस्टाइन से
if the person is suffering with a mouth ulcer, this is the small intestine heat or the heart heat. So definitely we have to work on the small intestine, right? Any problem in the gut, we have to work on the small intestine. Suppose one person is not able to digest the wheat, chapati, roti को कोई नहीं पचा पाता है. The person is suffering with the gluten allergies and celiac disease. This is called celiac disease. So we have to work on the small intestine. Crohn's disease. Okay, we have to work on the small intestine. So the other number of disease, we have to work on the small intestine. Okay. So here,
Sir,
yeah.
sir, even
viral
the
disease. Yes.
sir, even the smell, foul smell coming out from the mouth, we have to work on SI.
If the foul smell is coming from the mouth, foul smell coming from the mouth, so we have to find out the reason. That is the stomach issue. Stomach issue, right? If the person is suffering with a stomach issue, so we will not able to sit near. The person will talk. We will feel the bad smell from the mouth. So that is the stomach issue. Stomach heat, some disharmony of the stomach. we have to use the CMP part of the stomach, right?
सर वायरल और बैक्टीरियल इन्फेक्शन भी ट्रीट कर सकते हैं?
Yeah, so like viral bacterial infection, what is your logic behind that? You have some logic? Yeah, then tell me.
सर अभी स्लाइड था ना, उसमें स्मॉल इंटेस्टाइन में लिखा ना गैस्ट्रोइंटेस्टाइनल वायरल और बैक्टीरियल इन्फेक्शन.
No, so I am telling you any problem of the small intestine, whether it's because of the virus, because of the bacteria, because of eating, because of bad habit, because of improper sleeping, because of anything that the person is having problem with the intestine, then we have to work here. It's not only because of virus or bacteria. Whatever problem happening in the small intestine due to any reason, we will work on we will use the CMP part. Clear?
ओके सर.
माउथ अल्सर का ट्रीटमेंट मिल सकता है क्या हमें?
क्या भी बोल रहे हैं?
माउथ अल्सर हो गया है तो उसका ट्रीटमेंट मिल सकता है क्या? हीट जो आप बता रहे हैं
We will
SI में और
not, see, we will not deviate from the topic. Okay, we will not deviate from the topic. We will go step by step. Okay, if we just starting protocol, then we'll just go in the protocol. You have to, I will tell you, you will make the protocol. I will tell you concept. Protocol I will take from you. आपसे बोलूंगा कि मुझे प्रोटोकॉल बना के दो, मैं आपको बताऊंगा कैसे बनाना है. ठीक है? फाइन. ओके, सो नाउ अब देखो ये हम so now pericardium meridian, very important meridian. Dr. Boole has given the name circulation meridian. As per the Dr. Boole, the name of pericardium meridian is the circulation meridian. So Dr. Boole is telling CI meridian. We are telling PC, Dr. Boole tells CI. The circulation meridian, the pericardium meridian, is a very, very important meridian working for all the vessels. सभी प्रकार की vessels के लिए काम करता है. Now we are having the problem in the vessels. We are having problem of the arteries, like blockage in the arteries, maybe in the legs or the varicose veins. Varicose vein is the very common problem happening in the veins or any arteries, anywhere in the body. Blockage in the coronary artery, the arteries.
And the world full of love and peace. And friend have a
So एकदम से अनम्यूट कर लेते हैं बार बार अपने आप को. देखो मैंने म्यूट किया, क्विकली अनम्यूट करके फिर पता नहीं क्या क्या सुनाते रहते हैं लोग. If you have any question, you can unmute. Otherwise, you keep mute yourself. Do not disturb.
Mute everyone, sir. So if anyone has queries, they can raise their hands.
That I have to do. That I will do from next class. That is fixed. That definitely I will do from next class. Today only I am not doing that. Okay, fine. From next class, you have to raise the hand. Then I will ask you, tell you to unmute. Okay. So now, if the person is having suffering with the problem of the blood vessels, we will see any artery problem, we will use the circulation meridian. Circulation meridian. So circulation meridian is very good for all the vessels. We will use it. Okay, we will discuss because this topic is very big, and we will discuss about the circulation meridian. I will tell you one example. Just focus on this part. This is the pelvic area. Pelvic area, right? As per the Dr. Boole, the pericardium 9 is the point who can improve the blood circulation in this area. If the male during the, if we talk about the males, अगर हम males की बात करें, during the erection, there is a blood pump in the genital part. Okay. Genital part के अंदर blood pump होता है. And when the, so because of the blood only, there is a erection is happening. But because of the problem of the arteries, because of the problem of the blood vessels, cannot retain the blood, जब वो blood vessel blood को retain नहीं कर पाती है, so person suffer with the erectile dysfunction. Okay. So as per the recent report, if the person is suffering with the problem of the blood vessels, there is a blockage inside the blood vessels, arteries will suffer with the ED or the erectile dysfunctions. So we'll work with the pericardium meridian, and one very special point is pericardium 9. Because pericardium 9 will be improving the functioning blood circulation around the genital part. So pericardium meridian is also called circulation meridian. With the help of this circulation meridian, we can improve the circulation in any part. So we will target, okay, we want to improve the circulation in the legs, this point. We want to improve the circulation in the genital part, this point. But we want to work on the entire circulation. Then take the CMP point of the pericardium meridian. One point will work on the each and every type of the circulation. Is it any question?
Sir, I have a question. So, the CI, circulatory meridian, is only for the arteries, or will it be for veins also?
Artery, veins, all the vessels.
Both. Okay.
Artery, vein, blood vessels and all. Okay. Now, you know, it's a very common problem nowadays, swelling. You know that swelling is very common problem, water retention, swelling in the legs, feet, pedal edema, पैरों के अंदर सूजन आ जाना, पैरों के अंदर edema हो जाना. Okay. Very common problem nowadays. So when the person is suffering with the any type of the swelling, we can see here. So we have to do the cleansing of that area, and we will work on the lymph meridian. With the help of lymph meridian, we will use the CMP part of the lymph meridian, and we'll working on the swelling or water retention. Swelling anywhere in the body, we can use CMP point of lymph meridian. हम lymph meridian का CMP point use कर सकते हैं, right? So lymphatic drainage meridian. This is the lymphatic meridian. So lymphatic drainage needed when the person is, हमें किसी के the person is having sinusitis, नाक में कफ भरा हुआ है, we will do the lymphatic drainage. Swollen lymph node enlargement हो गया है, कभी कभी देखो यहाँ एक्जिला में गांठें बन जाती हैं, pelvic area में lymph node की गांठें बन जाती हैं. So when there is a lymph node enlargement anywhere, swollen lymph node, we will do lymphatic meridian treatment. Tonsil are the lymph gland. For the tonsillitis also, we will do the lymphatic drainage. Ear infection, there is a pus discharge from the ear, even the rheumatoid arthritis, and there are many diseases. Even there is a cyst in the breast, we will do lymphatic drainage. Lymphatic drainage is very important, and we can do by the lymph meridian and by the point. So we can take CMP point of lymph meridian, and who will work on sinus, swollen lymph node, tonsils, ear infections, rheumatoid arthritis, skin infections, the cyst in the breast. क्यों काम करेगा? क्योंकि जैसे हमने CMP पॉइंट लगाया, हमने शरीर के lymphatic drainage को एक्टिवेट कर दिया. As soon as we are putting the CMP point, we are activating the lymphatic drainage, and as soon as we activate the lymphatic drainage, then we are doing clearance of the lymph. Okay. So हमने especially nowadays many female is having breast cyst. So for the breast cyst also we will work on this. Lipoma is the different condition. Lipoma is the different condition. Okay, that we cannot consider in the lymph, right? Okay. But we might take the help of lymph. Now I will come to that. After this, after finishing this, we will discuss each and every meridian very properly. So you can understand, okay, this is a CMP point, I will put in this way. Okay, this is the RP point, I put in this way. Okay, that we'll discuss next week. Any question till now?
सर विटामिन डी डेफिशिएंसी कौन सा सीएमपी पॉइंट में काम करना है सर?
Vitamin D deficiency के लिए तो actually mainly there is sun exposure. because vitamin D is already available in our skin, so we are working on the skin degeneration meridian, and we are giving the sun exposure. Sun exposure is very much necessary for them. Just by doing the treatment, it's difficult to improve the vitamin D. For the vitamin D, we have to take the sun exposure for it, sure.
Sir,
Is
for
it
artery blockage, do we work on SI and heart both?
For blockage of the arteries, we have to work, like just I told, that for arteries, who is controlling? Pericardium. Pericardium, the circulation meridian, working on controlling all the arteries, all the veins. So we have to work on the pericardium. Okay, pericardium. Now, if you want to treat the heart problem, like suppose pericardium is the covering of the heart. Okay, so if pericardium, as per the TCM, if the person is suffering with the problem of the arteries, blockage, and all, that time, and the person is having chest pain, that time also we use the pericardium. But here we are telling, especially if you want to work on the blockage of the arteries, we have to take the point of the pericardium. Pericardium is a circulation meridian who is keeping proper circulation in the each and every artery and the veins.
सर उसमें फैट डिजेनरेशन भी ले सकते हैं ना उसके साथ में?
अगर ब्लॉकेज है तो फैट वाला लेना ही होगा. अगर फैट जम गया है, then we'll also take the fat degeneration meridian. Okay, fine. So done for today. And now we'll see you in the next class. Yeah.
Sir, placement of where to work on SI meridian and CMP point and nerve CMP point on the hand.
Repeat your question.
Where to work? We have understood the meridian, the CMP meridians of nerve, SI, and pericardium. But where to work? Where are they placed?
In the you have joined yesterday class?
Yes, we have done.
Yesterday class I told.
Nerves were not. Nerves and SI was not covered. Heart was taken.
So actually I announced in the next class we are going to work, because see, in the location, very, very proper location in the next.
Location, yeah.
Because see, now you understood how the importance of the SI meridian. If I tell you the point location, then you can apply that. Okay.
Sir, I have a question. Going forward,
Yeah.
you will be discussing about all the plexuses also कि वो कहाँ पे होते हैं location, क्योंकि जो points आएंगे कि इस plexus का है वगैरह, तो आप वो plexus के बारे में भी समझाएंगे?
Whatever written in the syllabus, I will discuss. Because there are too many plexus. If I keep discussing the plexus, there are 40 plus plexus. There will be one course I can make only on the plexus.
Correct.
One course of 2 months. Okay. So whichever required, I will discuss. अभी मैंने कमिट कर दिया ना, तो पीछे पड़ जाएंगे. फिर मान लो 4 महीने के बाद कोर्स खत्म हो गया, फिर लोग पीछे पड़ जाएंगे. अभी प्लक्सेस आपने वादा किया था, फिर मुझे और 2 महीने कोर्स लेना पड़ेगा. तो भी आपके लिए जरूरी होगा, वो सब पढ़ेंगे.
ठीक है सर.
सर, व्हाट इज प्लक्सिस?
प्लक्सिस का मतलब होता है नर्व का जाल. जैसे जो भी नर्व के जाल होते हैं, नर्व का जाल होता है. जैसे हमारे घर में इलेक्ट्रिसिटी आती है ना, तो कैसे आती है? बाहर एक वो बड़ा ट्रांसफार्मर लगा रहता है, ऐसा बड़ा, है ना. फिर वहां से आती है ना इलेक्ट्रिसिटी, तो वो ट्रांसफार्मर प्लक्सिस है. ऐसे हमारी बॉडी में क्या होता है, सब जैसे एक प्लक्सिस है, हमारी बॉडी के अलग अलग प्लक्सिस है, ऐसे गुच्छे हैं, वहां से नर्व जाती है, उन्हें प्लक्सिस बोलते हैं. तो डॉक्टर बोल रहे हैं प्लक्सिस के बारे में भी, प्लक्सिस पर ही वर्क किया है. ओके. तो जहां जहां हमें लगता है कि जरूरत है, वहां हम छोड़ेंगे. ठीक है, वहां हम पढ़ेंगे.
सर, किस यूनिवर्सिटी का सर्टिफिकेट मिलेगा?
एक बहुत बड़ी यूनिवर्सिटी है, 300-350 एकड़ में फैली हुई है. इट्स अ वेरी बिग यूनिवर्सिटी. हमारा जो कोर्स है यूनिवर्सिटी सर्टिफाइड है. दिस कोर्स इज यूनिवर्सिटी सर्टिफाइड. ओके. या
So solar plexus also has to be
actually
seen.
solar plexus is the different things. When we talk about the plexus, so in the human body there are many plexus. जब हम प्लक्सेस की बात करते हैं, हमारे बॉडी में प्लक्सेस का जाल बिछा हुआ है। प्लक्सेस का मतलब है बड़े बड़े कॉम्प्लेक्स गुच्छे, नर्व मिलकर बनाती हैं। जैसे आई विल गिव यू एग्जांपल, ब्रेकियल प्लक्सेस C5, C6, C7, C8, T1 नर्व मेकिंग ब्रेकियल प्लक्सेस। तो देखो सर्वाइकल नर्व है, C1, C2, C4 making cervical plexus, then C5 onwards they are making brachial plexus। दो plexus तो यहीं पर। फिर lumbar plexus, sacral plexus, coccygeal plexus, there are too many plexus, cardiac plexus, pulmonary plexus, celiac plexus। तो जो solar plexus की आप बात कर रहे हैं ना, उसे हम celiac plexus बोलते हैं यहाँ पर, है ना, जो digestive plexus भी कहलाता है, hypogastric plexus।
Yeah, it is above the stomach.
Which
If anyone gets hurt there, they say they may collapse also.
you are taking out
The
the solar
solar
plexus?
plex area.
Yeah. So it is above the stomach. Okay, below the sternum bone.
Yes.
सर आप कहाँ कंसल्टेशन के लिए मिल सकते हैं अगर किसी की ट्रीटमेंट कराना है?
अभी मैं 4 महीने कहीं नहीं मिल सकता, क्योंकि
वैसे कहाँ पे?
मैं इसलिए नहीं मिल सकता कि आई वॉज स्टडिंग ऑस्टियोपैथी फॉर 2 years। अभी उसके लिए मुझे कैंप्स में जाना होता है, और कहाँ जाना है, कैसे जाना है, कब जाना है। हालांकि क्लास के समय में अवेलेबल हो जाता हूँ, लेकिन मुझे जाना होता है, इसलिए मैं अभी 3 महीने का 4 महीने अभी मैं नहीं मिल सकता, उसके बाद ही मैं मिलूंगा। क्योंकि उसमें शेड्यूल इतना हैक्टिक होता है ना कि आई कैन नॉट सी एनी पेशेंट्स अदर।
सर किस सिटी में रहते हैं वैसे? किस सिटी में अवेलेबल है? आप किस सिटी में हैं?
अभी मैं उड़ीसा में हूँ, और अगस्त से हमारी सिटी बदल जाएगी। कौन सी सिटी हो सकती है? इट माइट बी बैंगलोर, इट माइट बी पुणे, इट माइट बी गुजरात, आई डोंट नो। दे विल,
मतलब रहने के लिए सर या कैंप के लिए?
नहीं, आई विल बी लिविंग 3 months wherever they will allot me, either बैंगलोर और पुणे और गुजरात।
ठीक है सर, बैंगलोर चूज करिएगा।
No, I cannot choose, they will give। But if they ask me, I will tell Bangalore। If they don't ask me, then okay।
So we have done the location of lymph and lung, TW, heart, spleen, and liver. So all rest of them, the locations will be shared in the next class.
Yeah, definitely, because next 3 class we will working more on location।
So tomorrow you're not working ना?
तो सिस्ट भी में काम करेगा पीसी मेरिडियन में, जो आप बता रहे हैं?
जी क्या बोल रहे हैं
सर? अभी जो आपने बताया है सिस्ट में जो पीसी मेरिडियन जो है आपका काम करता है, तो सिवेसियस सिस्ट जो होती है किसी भी सिस्ट में काम करेगा ये?
सिस्ट में कौन सा मेरिडियन?
पीसी पेरिकार्डियम।
पेरिकार्डियम। मैंने बोला कि जो पेरिकार्डियम मेरिडियन इज वेरी गुड मेरिडियन वर्किंग ऑन सर्कुलेशन। Circulation means circulation is happening through the arteries, through the veins. If there is any blockage in the veins, like blockage in the artery, any problem of the artery, any problem of the vein, like varicose vein, blockage of the coronary artery. So pericardium meridian is very good for each and every problem of the artery and vein. I told this.
So for healing of wound, if there is a pus,
होती है सर sebaceous cyst।
सिस्ट के लिए
sebaceous cyst,
हाँ वो मैंने बोला था lymphatic drainage। I will discuss with you, don't worry for that। अभी तो सिर्फ हमारा स्टार्ट हुआ है। I will discuss because lymphatic channel will discuss। There is a pathway of the lymphatic channel, lymphatic 1, lymphatic 2, lymphatic 3, lymphatic 4। There are point of the lymphatic meridians। So lymphatic 1 will do the cleansing of this part, lymphatic 2 will do the cleansing of this part, 1 point will do the cleansing of this part। So in this way, each and every point will do the cleansing of some different parts। So we'll discuss that। Okay.
So is there any logic to remember all these points, or we have to mug up only?
या इसमें लॉजिक है। लॉजिक क्या होगा? ऊपर के पॉइंट ऊपर की क्लींजिंग करेंगे, बीच के पॉइंट बीच की क्लींजिंग करेंगे, नीचे के पॉइंट नीचे की क्लींजिंग। लॉजिक है, लॉजिक आएगा। आपकी आवाज नहीं आ रही।
सर
When
tomorrow class is there?
only in palms and foot है कि
नहीं नहीं, पाम से जैसे कि लंग मेरिडियन है, लंग मेरिडियन तो पूरे हाथ में है, तो डॉक्टर बोल रहे हैं उस मेरिडियन के बीच में भी कुछ पॉइंट जोड़ दिए, है ना। ऐसे ही हमारे जो मेरिडियन हैं उनके बीच में भी कुछ पॉइंट जोड़ दिए, तो वो तो बॉडी में है। लेकिन डॉक्टर बोल के जो पॉइंट्स हैं वो हाथों में और पैरों में ज्यादा हैं। जो उन्होंने एक्स्ट्रा 9 मेरिडियन दिए ना, वो हाथों में पैरों में ज्यादा है। थोड़ा आगे तक गए हैं थोड़ा थोड़ा, लेकिन पूरे फैले नहीं। केवल लिम्फ मेरिडियन फैला हुआ है, बाकी तो हाथों में खत्म हो गए लगभग।
सर इसमें हम
like
कलर
a
यूज
shoe points है, like a shoe points elbow तक ही है।
नहीं नहीं, वो एल्बो तक भी नहीं है, वो सिर्फ रिस्ट के आसपास तक।
सर कलर यूज भी कर सकते हैं ना, कलर का?
कलर आप कलर यूज कर सकते हैं, हमने कल भी बताया था कि अगर
जी जी।
आपको एक बार समझ में आ गया कि करना क्या है, आप कलर यूज कर सकते हैं, है ना। कलर ऐसा नहीं है कि
जी
मतलब पॉइंट्स पर निडल यूज करना है, मैग्नेट यूज करना है। अब चाइना वालों ने थोड़ी बोला था मैग्नेट यूज करना है, ये तो इंडिया वालों ने खोज के निकाल दिया मैग्नेट यूज करना है ना। तो कलर भी निकाल दिया। अब चाइना वाले देखेंगे कि हम कलर लगाए बैठे हैं, तो चाइना वाले को तो हार्ट अटैक हो जाएगा देख के कि हमने तो पॉइंट, जो टीसीएम के पॉइंट बनाए थे मोक्सा करने के लिए, एक्यूप्रेशर करने के लिए, नीडल लगाने के लिए, इन्होंने तो पता नहीं क्या कर डाला, कलर लगा ला। तो ये इंडियन,
सर सर
you
हम
can
तो
use, you can do your creativity, see points in front of you, and if you have some other idea you can stimulate.
सर हम तो अधिकतर नीडल यूज करते हैं।
हाँ तो निडल तो है, निडल यूज करिए ना,
सर नीडल यूज
करिए करिए।
सर बेस्ट, गिव द बेस्ट रिजल्ट नीडल।
हाँ जी।
सर पैरालिसिस के केस में क्या
क्लास tomorrow है?
So next class will be on Monday.
So Monday, Tuesday, Wednesday, 3 days.
Yeah.
Oh, thank you, sir.
Actually, what is my plan? I will tell you. My plan is like that. That Monday, Tuesday, Wednesday will do class of level 1.
सर हमारा एक सवाल, हमारे साथ ये
Let
बहुत
me
गलत हो
speak.
गया।
Let me speak. Monday, Tuesday, Wednesday, 3 days a week will do class of level 1. Thursday will be break. Then Friday, Saturday will do class of level 2. This is my idea.
So give Sunday break na.
Please wait. I told you to wait. Friday, Saturday, I will do class for level 2. So 3 days for level 1, 2 days for level 2.
Okay sir.
So 5 days a week I will do.
सर लेवल 1 और लेवल 2 का ऐसे कनेक्शन नहीं है। लेवल 1 आने से पहले लेवल 2 आ जाएगा।
और सर पहले लेवल 1 समझ आ जाए तभी एडवांस करेंगे ना।
नहीं, लेवल 2 का जो मैं टॉपिक लेने वाला हूँ ना, आई लेवल 2 में जो मैं टॉपिक लेने वाला हूँ आई, उसके लिए लेवल 1 की जरूरत नहीं। फिर दूसरे टॉपिक के लिए लेवल 1 की जरूरत है। तब तक लेवल 1 का जो पोर्शन हो, जैसे आई खत्म होगी फिर जो दूसरा पार्ट आएगा, तब तक तो हमारे लेवल 1 की काफी हो जाएगा, है ना। आंखों का ट्रीटमेंट इंडिपेंडेंट, द ट्रीटमेंट ऑफ द ग्लोकोमा, मैकुलर डिजेनरेशन, कैटरेक्ट, पास का चश्मा, दूर का चश्मा, ब्लड विजन एंड ऑल, ये आंखों का ट्रीटमेंट, आंखों का अपने इंडिपेंडेंट ट्रीटमेंट है डॉक्टर बोल में, उसके लिए उसकी जरूरत नहीं है।
सर ये ज्यादा बेटर है या क्रेनियल ऑस्टियोपैथी ज्यादा बेटर है आंखों के लिए?
डॉक्टर बोल इज द नंबर 1 ट्रीटमेंट फॉर आईज among anything. Dr. Bol.
Eyes ka sir, treatment will be on hand or on the actual eye?
आंखों के अंदर नहीं होगा, दूर होगा, आंखों से दूर होगा, वो समझाएंगे।
But not in the hands.
हैंड में भी आंखों के आसपास होगा, आंखों के आसपास।
तो सर इसमें क्या मैग्नेट्स लगाएंगे आंखों के आसपास?
हम इसमें प्रेशर करेंगे, वो जो इलेक्ट्रोस्टिमुलेटर होता है ना पेन वाला, जो 500 रुपए से स्टार्ट होता है, 3,500 तक आता है, इससे स्टिमुलेट।
ये वाला होता है।
हाँ, ये इससे स्टिमुलेट करेंगे।
Hello, sir. I want to speak to you if you don't mind, please.
So we will
Hello?
use. Hello.
Yeah, is that the same level basic, the level 1 we did in the last 2 years? Is that the same, or is there something added to it?
Actually, even I try to do same, but it will never be same.
Yeah, that's good. That's good. That's good. The electronic pen, the rounded bit, is that okay?
Yeah, that is okay.
Can we use?
I will discuss.
you know,
I will discuss all the devices which you can use.
Yeah,
I will
because
discuss
I was
all the
not
devices
sure
which you can use.
if it's safe to use it, the cheap one, if it's safe.
It is very cheap. It starts from 500 rupees till the 3,500 rupees. It's very
Yeah,
cheap.
but it's okay. It's safe. I mean, it's safe. That's all.
It is 100% safe. There is no any issue.
Because we're talking about frequencies and vibrations and how long you
And
have
those
to
who are
put it.
acupuncture, see, you can use with a pen, with an electric device. And those who want to do acupuncture, they also can do acupuncture. This is purely your
That's
choice.
fantastic. That's very good news. Thank you so much. Yeah.
Okay, bye.
Thank you very
Sir,
much. Have a
I've
nice day.
got an
Bye.
acupoint finder. Can I use that for treatment? It's electrical only.
You click the photo, send me.
Okay.
And I will tell you.
Okay.
Okay, fine. So now it's enough for today. Thank you so much, everyone.
Thank you, sir.
Now next class will be only for enrolled participants. 3 days complimentary class is over for everyone. Okay. Thank you so much. Good
सर
night.
एक मिनट,
See you in the next class.
सर एक सवाल।
Thank you so much.
Thank you,
सर
sir.
हमें अपने हम मैसेज कर देंगे आपके पर्सनल पे सर, हमें हीट एसआई की और हार्ट की हीट कम करने का दे दीजिएगा। ये सर 8 दिन हो गए, माउथ अल्सर है सर हमारे यहाँ।
हम मुझे मैसेज करिए, मैं भेज दूंगा।
ठीक है, ओके ओके, थैंक यू सर।
ओके, बाय।